My name is Ziada Sela, the Director of Nursing and Midwifery Services, currently working with Ministry of Health, Community Development, Elderly and Children. In our directorate, we have prepared the guidelines in collaboration with partners on a respective and compassionate care at all levels. And for the past 7 years and plus, the evidence from Tanzania has helped to shape a global understanding around the mistreatment during facility-based childbirth and what it means to provide respective maternity care and RCC in general. And Tanzania actors have produced a growing body of literature and have tested some of the promising practices spoken about today. First of all, we create, in the policy, we create and cooperate RCC principles and national policies and regulations, so that to make sure every nurse and healthcare provider abide on this policy. But also in the community level, we have tried to engage them, so to make sure that the community accountability, especially and the angle of confidentiality, feedback mechanism, and also the education is to make sure everybody in the community knows about RCC, and also they can use this because they'll know their rights. And also they can get time to provide feedback to their facility or social leaders in the same community. But also, as I've said before, the Tanzania is home of a growing number of stakeholders. We have a lot of stakeholders which we committed to advancing respective and compassionate care. And many thanks to our previous Minister of Health, Mr. Umi Mwalimu, but also Mr. Moyo, the former Chief Nursing Officer, and Dr. Makuani, who is the Assistant Director on the RCHS, the Ministry of Health, for adoption of nursing and midwifery guideline, the national guideline for gender and respective care, mainstreaming and integration across RMCAH services in Tanzania, and inclusion of the issue in the One Plan 2. And now we revised sharpened One Plan 2, so we are going to the One Plan 3. As we know, the cause of mistreatment, it's a bit complex. It's ranging from social, cultural norms, health system constraints, health provider capacity, and it disempowers of client. And we know that it is not productive to point the finger to one issue or aspect of the system. But instead, we need to work together for change. And we believe that nurses and midwives at the heart of health system can be the center of determining solution. That's why my directorate, we decided to, in collaboration with partners, to implement this respective and compassionate care at all level. Working together with the leader and central and local government. Myself, I'm committed to serve as a champion and to support nurses and midwives and other healthcare providers to be catalysts for changes, to make sure RCC, it is strengthening, as I've said, from the primary level to the tertiary level. So we sensitize the regional administrative secretary, also directors of the municipals and district, regional medical officers, DMOs, and medical officer in charge to incorporate RCC activity in the CCHP, so that it will be easier for them to implement and to evaluate also in they can evaluate monthly, quarterly, biannual, and annual to see the implementation of this RMC. Okay, recently we managed to conduct a 2-day meeting from 11th to 12th February, and a total of 249 participants from national, regional, district health facilities attended this meeting. In the meeting, was included leaders from all levels, and we have TAMA, TNMC, Tanzania Nursing and Midwifery Council, and the Tanzania Association, Tanzania Nurses and Nurses, National Nurses Association, tutors, but also TAMA, Tanzania Midwifery Association, but also included the development partners. And during this meeting, we conducted a lot of activities, but the main agenda was how to implement and strengthening RCC and RMC at all levels. And the main goal also was to improve the governance, leadership, and quality of care for better health outcomes. And the expected outcome was nurses and midwife leaders to understand their roles, challenges, and the opportunity on provision of RCC and RMC services at all levels. We, as the Ministry of Health, first of all, have initiated the system which is called the Afya Maoni, and this system used to capture a suggestion, and if there is any complaints from the community, communities, they have access to enter all complaints in this Afya Maoni system. We have started with 2 regions, but now our plan is to make sure we scale up at all 26 regions in mainland Tanzania, but also to strengthen feedback mechanism from the health facility to the community, but also from the community to the health facilities. But also to conduct biannual meeting with the community leaders, but also representative from the community to get feedback from them on the services we provided, if there is any challenges, so that we can sit together and make sure we get the solution of the problem which happened to one of the health facilities. But we have the plan to improve mentoring and coaching, because we believe that we need to mentor them, we need to teach them, at least to remind them on the RCC and RMC. So what we plan to do, first of all, is to make sure we capacitate nurse leaders and midwife to conduct comprehensive supportive supervision and to provide mentoring and coaching for the feedback identified during the supportive supervision, but also to conduct post-training follow-up. After conducting the training, we need to do the follow-up to make sure they implemented what they've been trained at the previous, but also to prepare and accommodate RCC and RMC indicators in DHIS2 and the Health Information Management System, so that we can know where we are and we can get even, we can measure if we are improving or we are going down. But also, what is our plan now? We are continuing to collaborate with stakeholders to inform best practices. For now, we are working with the Africa Academy for Public Health, IAPH, through the HEAD project to launch an information sharing platform that houses respective care resources. Also, this will help us get information on RCC, but we have some challenges apart of having all these issues. The challenges, as we know, we are dealing with a human being. We are getting challenges, especially on attitude, and we are trying hard to make sure they will change, but for now, we are still getting some problem among care providers, but we believe as time goes, they will adapt to RCC, RMC. But also we are getting a problem on inadequate teamwork to effect change on agreed RCC services. That's why we are planning to make sure every RMO, DMO is incorporate RCC activity in their CCHP. But also we have a shortage of funds, which limits us to scale up orientation of RCC training. Our next step in advancing RIC, first of all, as I've said before, we need to capacitate leaders and to strengthen quality improvement team at all levels, so that they can get time to evaluate what they did, to evaluate how healthcare providers provide these services to the different clients, but also to strengthen the discipline committee. This also will help us to make sure those who are not ready to change, they be called with this committee and take the proper action. But also in collaboration with director of the policy and the planning, we need to develop the M&E indicator. I think here we'll collaborate also with the IAPH to make sure that we have this indicator. And also to prepare documentaries of success stories and share it at all levels to make sure everybody knows about the RCC in the community, in the health facilities, but also to conduct a follow-up of postnatal follow-up, because nowadays when mother gets discharged, when she goes home, there is no a good mechanism to make sure we are going to follow up these mothers. So we are trying to, we have planned to initiate this postnatal follow-up up to 48 days after deliveries, but also sensitization and placement of customer care desks in the regional referral hospitals and district hospitals. Lastly, I would like to thank you, AAPH, for your collaboration. For sure, you always be ready when we need assistance from you. So thank you so much, AAPH. And lastly, what I want to say, nurse and midwife are the heart of the health system, should be the center of determining solution of any challenges in the health settings. Thanks very much for listening. Wishing you all the best. Thank you.